But we're on, and we'll see how many people jump in here. Maybe I just open my phone up. Oh, I better turn some stuff down, looks like. I only got one mouse. I got to switch back and forth here. Yeah, I hear myself talking. There we go. I got it. All right. Should be live. Yeah, it looks like we do have some folks in here. We have Mateo of 1371. How you doing? Good to see you in here. We'll get a few more people in here and we'll get going.
Where's Griffin? Where's Cody?
Get my live screen back up here. Did the old, I didn't mute the screen button again, Bruce. Oops. Yeah, there we go. How's everybody doing tonight? Hey, how you doing, Scotsman? Good to see you. How are you this evening? Yeah, make it so I can see everything here. I'm blind. Get rid of that background crud. There we go. Hey, how you doing, West Wind? Good to see you, Wayne. Jewish Rednecks in. Hey, Uncle Al. Am I missing anybody? Hey, we're going to get kind of going here because kind of long, drawn out thing. We're going to talk about medical tonight. What we're going to do is we're going to talk about the things that you should be stocking up on prior to bad things happening. Because if you wait till the bad things happen, then you're probably not going to be able to stockpile up on it because everybody else will already have done it. So I'm just going to start over, with some of the things that you can get over the counter. And over the counter stuff is stuff that you should be piling up on so that if something bad happens that you can take care of you and your family. But not only that, maybe the people around you as well, because they may not have thought things through. So the first thing I'm going to cover is ibuprofen, and that's a compound. It could be like Motrin or Advil, and it's an anti-inflammatory medication, not just a pain reliever. So that would be one of the things that you'd want to look into getting. Acetaminophen is another thing. Now, it's like Tylenol or something like that. It is a pain reliever, but it's not an anti-inflammatory drug. It's a little more gentle on your stomach. So it's available for doses in children as well as adults. So that might be something that you'd want to keep in mind. Another thing, I don't know too much about loperamide. Do you know anything about that, Bruce? Backwoods.
That's typically things that you're not going to be dealing with, because when you start getting into these drugs that are not, the actual like acetaminophen or whatever over the counter, if you're using it for the wrong things, that can be very bad. So stick with what you know. You don't want to need to pick up the physician's desk reference to cross-reference and see why you're using this, or if you need to use it. If you know you have an ache in your muscles or something and you take a Tylenol, it's going to help. Stick with that. Keep it simple, stupid. That's what we do on the ambulance too. When we were doing that, we would just keep it simple as possible, because you start getting into all this other stuff, you can have issues.
How about the skin antiseptics? What do you think about those?
Best skin antiseptic, and if you have a wound, you don't want to use this, but hydrogen peroxide is one of the best skin antiseptics. But the reason you don't want to use it on a wound specifically is because the hydrogen peroxide actually will kill the surrounding live tissue that's around the wound area. A lot of people don't realize that when they use hydrogen peroxide for something.
So that's on the wound, you actually want to use like a drinking water or something like that to flush it out, right?
Drinking water, and if you think there is some type of germ that has been in that area, it's going to burn like hell, but take an alcohol wipe and wipe over it with that, and that will kill a good majority of the stuff that's there. Because, I mean, we're talking, everything's gone sideways, so you're not going down to the hospital to get patched up. So you just going to do as much as you can yourself.
Absolutely. That's why you want to go to like Walmart or any of those places, get the stuff that you yourself know that you use for your family now, like iodine or something like that. Store up on those little simple items, and that would help you get one step ahead in case everything, like we're saying, goes sideways on you. That's another thing that you need to worry about is, say you or somebody in your family has some sort of chronic illness. You'll need to get with your physician and make sure that he's explained to him your situation, that you'd like to stock up on some stuff in case something were to go wrong. And you could tell him, like a hurricane or a tornado or something, where you wouldn't be able to get to the pharmacy or whatever to get your medications. So you would want to make sure to work with your doctor and have him help you get, say, like 3 months ahead of your medications, so that if something bad happens, you're not like going to be sitting there freaking out because now you don't have what you need to get through one day, much less 3 months, So that's one of those things that if you're not staying on top of it, like me, I have issues with my lungs. So I have slowly, my doctor knows that I slowly keep pills. I order a week ahead of when they're due. And most of the times they fill them. So I'll take that 1 week that I'm ahead, and I'll put that in another bottle marked with the same prescription name on it. And I'll put it in my kit. And I'll do that every time. And I have gotten pretty good. I'm about 3 to 4 months ahead of all my prescription drugs, except for the steroid inhalers and stuff I take. They won't let me store those up. But I have found a way around that.
The other thing you'll find that'll be hard too will be if you have the stronger pain medications, because of all the issues that's going on with all the oxycodone overdose.
Opioid
you're going to run into problems if you have one of those types of medications. They are super strict on that right now.
Absolutely. I got, luckily, before they started doing the opioid thing, I'm not on opioids all the time anymore, but I would get to the point where I would stash some back, because I'm not one of those guys that just gobbles them down. I took myself off of them because I didn't like the frame of mind I was always in, so I had the doctors wean me off of them. But before I did that, I made sure that I got 3 months ahead on each one of the ones I was taking. So now if something really bad were to happen, say I couldn't stand the pain for some reason, I could take one, but I found it easier just to put it in the back of my head and kind of get through it. But if stuff goes sideways, you may need to rely on that stuff, not only for yourself, but maybe your family members or someone in your community you could help out. I wouldn't practice that. I wouldn't. I'm not a doctor, but if things like Backwoods Law said, if things go sideways, they're probably not going to really be keeping up track of that stuff anyway. So,
Okay. Well, one of the things I always do is that even on prescriptions, if I get, even if it's something simple like a steroid nasal spray, anything I have that I got refills on, even if I don't need it anymore, I'll wait a little while and I'll get my refill on it anyway. This way, down the road, if something happens, at least I have it. If I ever need it, I stock it, I have it until it expires, or something that it goes past expiration that I have it. But I always get my refills whether I'm still taking it or not, because if something happens and I can't get a hold of it down the road, you don't want to be in that position if you can avoid it.
exactly. I do the same thing. I have some nasal sprays too that I take only when I need them. So, but they give me like a year's worth. So I'll wait a few months and I'll order another one.
Yeah,
And I'll
that's what
just
I
stick
do.
it in the box, And
Yeah,
that way,
I
if
do it
something
with
comes
that, even
up, I've
prescription
done it.
ibuprofen, all that
Yep.
stuff.
Exactly. We were talking before we started this live stream up, and actually we're talking about the antibiotics, how you can buy those right over the counter, by buying fish antibiotics. And why don't you go into that, since you were talking about the most there, Matt? Sorry.
Well, what I was just saying is that I was asking Backwoods Law his opinion on it, and because I see him all the time in the catalogs and stuff, and I have a pharmacist in the family, and she pretty much had told me that they're safe. They're pretty much, like we talked about earlier, they're made by the same companies that make the ones for humans, and they're pretty much made to all the same specifications, but they're technically not regulated by the FDA because they're for fish, but they come from the same factories, the same stuff. So, I've been told by pharmacists that they're pretty much safe for human consumption. I'm not trying to, I'm not a doctor, so I'm not giving medical advice here, but I'm going to start stocking more of that type of stuff myself. I can say that, and they're available. To me, they still seem like they're a little pricey, but that's the way it is for that type of stuff. Any type of over-the-counter stuff like that, but you can get them from online. You get them at Walmart. Will, you said you see them at Walmart. I see them in the Bud K catalog. You can order them.
Yeah.
But Bruce knows a little more about that than me.
Yeah, fish Mox is one of the biggest ones I've seen. Yeah, Fish Mox Forte or Fort, however you want to pronounce it. I've seen that on the shelves, and that's just a amoxicillin. So that might be something that you might want to put on your list.
Yeah, and there's also like a Cipro, a fish Cipro, and then there's there's a couple of them that I can't pronounce, so I'm not going to try and make myself look like a fool right now. But there's a few different ones out there, and you can get them. You can get them now. You can get 100 count, bottles of those things. So I just seen them in a catalog that came the other day, so I'm thinking about picking some up. Like I said, it seems a little pricey to me, but you can't put a price on saving a life. And an infection is
exactly.
something as simple as a tooth infection can kill you. That's there's a lot of deadly infections start in the mouth. I know it sounds crazy, but very true.
It's very true. Yeah, I was just looking through my notes here, and ciprofloxacin is like you could get that for fish Flox Forte is ciprofloxacin, and they're starting to sell that in 100 count bottles now. And I'm not really sure how much they cost. It's probably going to be pretty expensive, but that could be an over-the-counter fix for you if your doctor doesn't want to help you build up your supply. That'd be something to think about.
Yeah, I'll be back in 1 second. I'll tell you exactly how much they cost. I think I actually have the catalog for it.
Yeah. All right.
And the other thing you want to make sure that if you're getting into any of the like amoxicillins, ciprofloxacin, all that stuff, you need to be very sure that if you think you have that type of infection, that you're using the right antibiotic. That is very critical, because if you don't use the correct antibiotic for whatever your ailment is, you can actually mutate the genes in whatever the bug is that you have, and it could make it not work with what should work on it, Cipro or amoxicillin, if that's what should have worked on it. In other words, you can create a resistant strain of an infection by giving yourself the wrong antibiotic. So it's very critical. If you're going to be stocking things like that, you need to have a good PDR, physician's desk reference, or the nurse's desk reference, which is what nurse practitioners use, or one of the pharmacist doctor of pharmacology books, so that you can look in and you can see what your symptoms are. And we're talking, this is, after everything went sideways, because you're not going to have a doctor you can run to down the street. So that's a very critical thing, because if you give yourself the wrong type of antibiotic, you can actually do more harm to yourself and those around you. So it's very critical to not just say, oh, well, I'm not feeling good, and pop amoxicillin or something. Don't get into that mindset.
Yeah,
So you guys
exactly.
want to know the prices here? I'm sorry.
Sure, go for it, Matt.
Well, the Fish Flex, it's actually not as bad as I thought. The Ciproflexin, am I pronouncing that right backwards?
Yep.
That runs 100 count for the 250 milligrams, about $40. And then the deoxycycline. See, I'm trying to pronounce it. I don't know if I'm pronouncing that right. But that's that for 30 count of that's like $60. That's expensive. But then the other stuff, the amoxicillin for 100 count of the 250 milligram is $25, and then you can get the 500 milligram is like $20 for a 30 count. So I mean, it's expensive, but it's really not that. It's not that horrible.
Exactly, and we were talking about you could store that stuff. Bruce or Backwoods was saying that we could actually take that stuff. You could seal it up in a vacuum sealed bag and throw it in one of your prep bins and store it in a nice, dark, cool place, and it would probably last like what were you saying, Backwoods? 20 years, maybe even longer.
Well, yeah, it's not me that was saying that. That was actually a study that the U.S. Army had commissioned from Johns Hopkins Hospital, and they did a in-depth study. I think it was like 2 or 3 years long, and they went in with pharmacologists, PhD doctors, regular doctors, and researchers. And the Army wanted to know, okay, all this stuff says it expires in like 6 months or a year. But if we have this stuff in a temperature controlled room, out of the sunlight, no oxygen's able to get at it, what can we expect shelf life wise out of these pills? And just about every pill that they went and they looked at least at a minimum, you could get 20 years of shelf life out of it by vacuum sealing it, keeping it in a dark, cool area that never gets above 80 degrees Fahrenheit. And it had, they said, I think in the report it said it was at least 96% efficacy, which means that in 20 years, you pull that bottle out, it would work 96% as well as it would have fresh out of the pharmacy when you just got it made. So that was an actual Department of the Army report that was commissioned, and they did I think it was a $20 or $30 million study on this. So the Army would know, hey, all this stuff we have stockpiled, we don't have to throw away every 2 years. We can keep it dry, cool, and vacuum sealed, and we're good.
Yeah, there's a lot. It's interesting because there's a lot of stuff that, that can go past its expiration date that people don't. People get too scared of, and there's other things that people are too lax with. Like we all know aspirin, right? Aspirin can be pretty nasty when it gets, badly expired. And then there's other stuff, that this stuff, even Israeli bandages come through with expiration dates. I mean, there's stuff that people got to be aware that the stuff that is still good to hold on to, even if it's expired. People really got to do their research on what's safe and what's not. I think the average Joe doesn't know enough about it. I think that's an area I think everybody needs to really start looking into, us, preppers and survivalists.
A lot of people just overlook it.
Yeah.
I can't believe it. Everybody talks about all the stuff that they do when they're prepping, but there's a lot of times I have noticed that people actually overlook the medical end of it is that we're not talking about the trauma kits and stuff like that yet. Even we're talking about the simple stuff
Yeah.
that you can actually get right over the counter that you can be stockpiling. As long as you store it in a proper container in a dark, cool place, it would probably last a long time. But people just kind of overlook it, thinking, well, I've got what I need for now. I can always run down to the store when something happens and gather up what I need. But that's really not going to be the case.
Yeah,
And
well, those people who also live in more rural areas, like the place where I'm going to be soon. Um, a lot of those type of areas, for a lot of people, if you might live 45 minutes an hour out, and then if crap gets really bad, that 45-minute hour drive might be a 2-3 hour drive, and you're not gonna be able to make that all the time. Let alone be able to. You might not be as easy for you to find something. So it pays to stock up on this stuff. It's really important. I think you're right, Will. I think a lot of people do overlook the essential medical stuff.
I think a lot of them that overlook it are those that don't take any prescription medications. Because I've noticed a lot of people that have some kind of prescription medication, that's one of the things they think about is the medication. I think that
Yeah.
plays a factor in it.
that's very true, Cheryl.
Yeah, there was a point in time I was on a couple different blood thinners at one point in time. Not at the same time, but they changed. And that's something that, good luck if STH, hits the fan there. Good luck trying to get your hands on some Eliquis or things of that
Warfarin or
nature.
anything like that.
When something like that happens, I mean, I can tell you the truth, that's something that even when I came off it, as long as my prescription was running, I renewed it because I just look at it. If I would ever come down, I came down with a DVT clot. This was a few years back. If I would have came up with one again, something bad happens, what am I supposed to do? That's not something that I'm gonna be able to get it. I'm gonna be able to get at my local Walmart per se.
Yeah, or run down to the local
Or knock on my neighbor's door. Hey, things are bad. I can't get down the road. Yep, never any Eliquis.
Well, it's like me. I have same issue, with my heart. One of my valves don't open all the way up, so I'm on blood thinners, and so I do the same thing like I told you before. They always make sure that I have them, so that I'm not without them. So I always order ahead. I always take the few that I'm ahead, throw them back for later, and I make sure I keep them in a nice, cool, dark spot. Trying to get them to keep that shelf life, as long as I can. And then I do rotate them. You have to rotate stuff. It's just like
that's really important too. In fact, that was something I was just going to bring up. So you already said it, Will. So you beat me to it.
Make sure you're rotating it, even though you're storing it back. Rotate it. It's just like food; it'll go bad. But if you rotate it, you've always after you trying to think of it. After you've got your backlog of whatever you're wanting, 3 months, 6 months, a year, whatever your mindset is, make sure that you're rotating. It's just like food. You still have to rotate it in and out and replace it with newer stuff. Otherwise, you're going to say, oh, I've got that stuff. And when you go to need it, it's not going to work for you.
On the topic of blood thinners, quick, I wanted to ask backwards his opinion. I wanted to ask you your opinion on aspirin. What do you feel about stockpiling aspirin? Because I do it, but a lot of people say, talk a lot of crap like you shouldn't stockpile aspirin. It's not important. But I've known people that aspirin has saved lives, at the same time.
Absolutely. And aspirin can be very useful. Now, the key thing is if you ever open a bottle of aspirin and you get a rotten egg, like
smell,
a hard-boiled egg or a rotten egg smell out of it, that is the one binder component in aspirin that goes bad. That's the smell it will give off. And that comes directly from the EMT course that I went through. They told us, if you're ever at a patient's house and they're having weird symptoms that you can't diagnose, go to their medicine chest and look and see if they have aspirin. If they have aspirin, pop the lid off. And if you smell a hard-boiled egg or a rotten egg type of smell, take the aspirin with you, tell the docs you got an aspirin poisoning, and run as fast as you can to the hospital. So that's how you keep yourself from that problem.
Yeah, I mean, I'm familiar with the smell test, as well, but I just wanted to get somebody the medical, with more medical trainer you do, more their opinion, because I mean, I obviously I stock aspirin because to me, I mean, aspirin is a blood thinner. So as a last resort, that's something I could, if I had to, something I could resort to if I needed to. But of course, aspirin's definitely, most of us know that bad aspirin can kill you.
Yeah.
But,
Don't take blood thinners and aspirin together.
Oh yeah. No. You definitely want to stay away from the NSAIDs, and also, I mean, listen, when it comes to it's always risk versus reward with any type of blood thinner. I mean, I was doing construction with Xarelto at first, and that there's no antidote for that. There's no reversing agent for that one. So, everybody's got to be careful with that too. Aspirin's a little safer if your doctor will allow you to take it. Anyway, not that I should be giving medical advice, but
Yeah, we're not doctors. We're just giving advice.
Well, and the other thing is some people can't tolerate aspirin too. That's something that you always have to keep in the back of your mind. Some people cannot tolerate it.
very true.
Regular aspirin used to upset my stomach before I ever started taking blood thinners, just regular aspirin. So I would stay away from it anyway because it would just give me indigestion. Not everybody can take it, like you said.
Yeah. Plus something. I know we're not on the topic right now, but just quick reminder to anybody that is on aspirin or blood thinners, definitely. I mean, those with military backgrounds will all tell you having a blood stopping trauma kit is essential anyway. But if you're on blood thinners or an aspirin regimen or anything like that, having one of those in your vehicle and on your person and in your house in multiple places is just essential, guys. So if you haven't thought about that, definitely put some together.
Yeah, old man saying they have him on warfarin for a blood thinner. Yeah, that's what they have me on for too, old man. Thins my blood so it can get through that one valve in the back of my heart.
Also, keep in mind if you're stocking liquid medicine will go bad within 6 months typically. Now, your IV solutions, stuff like that, have a little longer shelf life, but any of your bottled medications like the diabetic drugs, any of the insulins, warfarin, any of the liquid medications that are in a liquid form, those will go bad very quickly.
Oh yeah.
Keep
Also,
that
the
in mind.
insulin. I think they came out with a more stable version recently. I don't know what it is though.
I can't remember the name of it either, but I know that they did come out with something besides the regular insulin.
Yeah, that stuff. Yeah, backwards is right with that because actually I had a dog that was diabetic, a husky. I used to have to shoot her up with insulin twice a day. And that stuff would go bad if you don't use it. Keep it refrigerated. It's too hard to keep. I mean, that's another thing. People diabetic, you guys got to take real extra precautions.
Well, another thing too is you have to be real careful about what over-the-counter drugs you take, along with prescription drugs. Because I know when they were going to put me on arthritis medicine, they told me that I could not take ibuprofen with it because it would affect it, the way the medication worked. So you have to be careful of what medications people are on.
Yeah, prescription medications are definitely iffy. You've got to really know what you're doing before you stockpile those up. Make sure that you're checking with your doctor on all that stuff.
Also, it might not be a bad idea for people who are on, especially some of the heavier, prescription drugs with a lot of side effects. Is that if you got especially if you got a close knit survival community, friends or family, however you want to put it, or just not even just the people in your household. But it's good to have a list of the drugs you're on and also the side effects that they could have, because if something happens, if you take a drug that could cause seizures, and the next thing you know, you're having a seizure, it's a good thing for somebody to know what might have caused that, so that you know how to necessarily be treated or be handled. That's something I think that people need to really take into consideration. I mean, I do it, but I don't think too many people keep a list of their meds and the side effects of them, the ones that are common side effects.
That's exactly right. I harp about this on most of my videos. I just am a firm believer in it only probably because of my own issues. Is I talk about people making sure they have an ICE card, or it's in case of emergency is what ICE is, in case of emergency, and make sure it's either on your person or in your bags or somewhere in your home where somebody can find it, so that if something does happen to you, they know, hey, I take this and this and this. My next of kin is this person. My doctor's this person. Have it all written down so that if the medics have to come to your house, or say that everything has gone sideways and somebody's trying to help you, that they can look at the list and say, hey, we can't give this guy this because it's going to mess with him. But I'm a firm believer in carrying an ICE card, and that card is an in case of emergency card, and it comes in handy.
Plus also everybody needs to remember too that, when you're prepping and stuff like that, it's not just about for the end of the world or when what hits the fan. It's also about you're prepping to prepare for anything that could happen. I mean, this type of things can happen on a daily basis. You could fall down the stairs. You could get into a car accident. I mean, things like that. Things like that can happen, and having this stuff nearby could save your life or help save somebody else's. So, it's also for just your regular day-to-day life. It's good to have this stuff. People confuse prepping with just surviving the end of the world with prepping, just to be prepared in general.
Exactly correct. That's why I always do all my videos is hurricanes, tornadoes, earthquakes, whatever. Those are all SHTF situations. It's not always going to be about the end of the world. An SHTF situation can be your house burnt down. That's an SHTF situation to you.
Mm-hmm. Exactly.
So yeah, I have to be prepared for whatever comes along. That's how I think of SHTF. It's not just a zombie apocalypse type of thing.
Yep.
So let's try to let's see. Wayne was saying something about herbal stuff for medical, and that's probably going to be a whole different live stream. And because I would like to have Wayne to come up with that, he's pretty good at that. So, but herbal remedies are very good to think about too. So I'd like to kind of get into first aid kits. Everybody has one. You saw the last video I did, any of you. I have a $10 first aid kit, but you should actually, that's just goes in my bag, but I actually have a trauma bag set up too. And you should always be adding to whatever you have, no matter what. Say, oh yeah, I went over to Walmart and I bought that big first aid kit they have there. I don't have to worry about nothing. Well, that's not always the case. You want to go into that backwoods?
Yeah, there was a comment I had to approve there. That was stupid. I don't know why it made me approve that. That was stupid.
Well, good.
There's two kinds of approaches you can go here with. Let's just start out with a basic first aid kit. Basic first aid kit is nothing about any type of medical stuff at all. You just need some stuff, and typically in like the medical field, we would call that like a boo-boo kit. In other words, you scrape yourself, you get a minor cut or something, you'll be able to deal with it with a basic first aid kit. So if you don't have any knowledge at all about anything medical, you've never taken even a first aid class, that's probably a good basic starting point for you, because at least you have something that you can do. Number one, self-aid, or if somebody else has a small and a minor type of injury, you could assist them as well. That doesn't mean you're going to have everything in there that's going to save somebody's life. This is just a basic kit. You're going to have some Band-Aids, some gauze, so that you can maybe do a pressure type of bandage on a larger cut or something, just enough so that you can try and plug the leaking, because that's typically what your issues are going to be. If you start leaking, it's a problem, because once that red blood gets out of you, you're not carrying oxygen with that blood anymore. And that's what you need in order to perfuse your body, is that blood. So you want to try and stop leaking as quickly as possible. And even if you don't have the precise tool to do it, something is better than nothing. If you're just sitting there and you're bleeding and bleeding and bleeding, and you're not doing anything about it, eventually you're going to bleed out. So, that's the one approach is I know nothing about it, and you don't want to learn anything about it. You just want to have a basic little kit. The other side of the house would be, okay, you've taken some first aid classes. You can do something a little more advanced, not something maybe that they would do at a hospital or an ambulance or something like that. But you have some training, some knowledge, and you want to have some extra items, and that would be where you're going to go more into like a trauma type of kit, and that would be typically what we're worried about in the prepping community would be something like a gunshot wound or a amputation of a finger or a limb or something, and you need to really do something dramatic in order to stop this from progressing quicker than it is. That would be more of the focus of the trauma type of kit. And inside of that realm of the trauma kit, there's two different ways you can go. You can say, okay, well, I'm only going to have stuff in this kit that I'm trained on and I know how to use, or I'm going to have everything in this kit that I can legally purchase and have, so that if I'm injured or one of my family members is injured and I have somebody walking down the road that's a registered nurse or a doctor and they offer to help, I have the tools with me for them to do what they need to do. So those are the two different scopes that you can go in there. And I mean, I can get as stupid into this or as light into it as you want to get. Cause I mean, I've worked on an ambulance, so I've been out there and done this stuff in real life. So it just depends on if somebody has like a question on some item that they have out in the chat, go ahead and throw it up there, put it in all caps, and I'll see if, I can answer it for you.
Yeah, I would say, excuse me, just for like a basic stuff, if you want to get above and beyond your, well, Walmart or who knows, we have a Dunham's here, first aid kit. Maybe think about putting in something like antibacterial cleaner or something. And always make sure I have them in my home, not just in my bags, but some nice latex gloves, not some rubber gloves that you get at the store, but some really nice, like surgical gloves, or the kind that caregivers use to handle old folks and stuff like that. Something that's going to be kind of stiff enough that you can work with them. Or maybe one of those masks so that if you have to give CPR that you're not actually putting your mouth over somebody else's mouth. You can get those masks fairly inexpensive. It depends on what you want. You want to breathe their germs, or you want to save their life type of deal, is how I look at it. So there's kind of all kinds of different stuff that you can get in there, and you can look it up online. I mean, some of this stuff, if you look in the right places, they're pretty inexpensive, Yeah, you could, getting into like a trauma thing would be like a irrigation syringe so that you can actually clean out the wound, by just squirting some fresh water through it, and get all the germs and the debris out of it, things like that, it's all simple stuff that you can just pick up.
Yeah, I mean, I tend to keep basically three different type of kits. I keep with a fully stocked I call it my fully stocked med pack, which I keep one in the house and one in the truck, and that's pretty much got everything but the kitchen sink. Then you got, actually, as Backwood says, I call it the same thing. You got your boo-boo kits, which your Band-Aids and your little antiseptic wipes and all that kind of good stuff. And then I have, trauma kits, which I keep everywhere, which those are something that I think people need to build to suit, what they best suits them. I mean, there's some basic stuff, but, that's kind of a thing that, just about, I think, I know, Will, I know you make them. I know Backwoods makes them and Wayne makes them. Everybody pretty much makes them pretty much out there. Especially people with military experience are usually pretty keen on having their own little blowout kits, and trauma kits, and, on their person at all times. Because, you also keep in mind, just so everybody knows, the amount of gauze, don't underestimate the amount of gauze it takes to stop major bleeding. It takes a lot just to put it out there, you guys need to have something to stop the bleeding and apply some serious pressure. Backwards, I know you can elaborate more on that, but just gauze itself, you're gonna go through a hell of a lot of gauze. Just keep that in mind, everybody. Hell of a lot of
Don't be
gauze.
afraid to buy boxes and boxes of it, or even rolls and rolls, because you're going to use it if time comes.
I keep a
Absolutely.
Israeli bandage with every one of my trauma kits, and that's something I found works really well as a compression dressing. But I can tell you this: that I've seen what happens when guys just need to use rolled gauze to try to stop bleeding on its own. It's a freaking it's like the mummy. It's crazy.
Another thing you should get, and I never really thought about it too much till I started taking blood thinners, and that is the clotting powder and stuff to make sure that you can stop the bleeding,
Yeah, Celox is, if you're on a blood thinner, Celox is what you need to use. You need to use that granulated Celox because that's what's going to stop it if you're on an actual blood thinner. If you're just on regular low dose aspirin or something, you probably be okay with the stop bleeding. But if you're like on warfarin or one of those heavy hardcore blood thinners that's going to like keep you from getting, like Matt was talking about, a DVT or something, you're going to need Celox because that's actually designed to make its own clot in the wound. That's why it comes in a granulated form.
Oh yeah, I still
On the backside of that, it does have to be removed.
boxes.
Yeah, that's something that's really
of them.
important. It needs to be irrigated out. I'm sorry, Will. I just meant to say that also before backwards. I completely forgot. I'm glad you said that. Because I've talked about Celox in a lot of my videos. Like I did a few of my little trauma kits, and a lot of times I forget to mention that you guys got to make sure that it's a quick fix. You still got to get it irrigated out because it could create a problem if you don't.
Yeah, if you could at least stop the bleeding, and then you can start working on the wound, But I have several boxes of it. I was just trying to add that in. I have several boxes of them because I take blood thinners. That's the only reason I have that many boxes. Is I figure if I get cut bad enough, I really want somebody to be able to stop the blood.
Well, and it's not a fix-all either. I mean, just because you have Celox doesn't mean it's going to work.
That's
So
true.
you have to be prepared for that too.
We have a question here. How do you feel about anticoagulants, salt? Mo Mello asked about anticoagulants.
Well, that would be like warfarin, wouldn't it?
Yeah, that anticoagulants, what that's going to do is if you take an anticoagulant, what's going to happen is that thins your blood out, and it typically will attack one of the 7 different factors in your blood that causes clotting, which is basically what warfarin or all the other Eliquis, all those, they typically work on 1 or 2 of the clotting factors that are naturally in your blood, so that if you get an injury and you're on some type of anticoagulant or you're on warfarin or something, that's why it's such an issue, because your blood typically wants to clot when you have an injury, but if you're on those, it will not. It will just keep flowing. That would be very bad to have an anticoagulant in your system and you have a major injury. It freaks us out when we'd have to go on an ambulance call and we get there and it'd be for somebody who fell over and hit their head, and then we find out after the fact that, oh, guess what? This 73-year-old person actually is on warfarin and they have a severe headache and they're showing signs of bruising around their eyes and their ears. And that's a very bad sign, especially when you're on a blood thinner, a anticoagulant. We'd have to scoop them up into the ambulance. And there's basically nothing that we as a paramedic, an EMT, even a flight nurse on a chopper is not going to be able to do much for you. They need to get you into a doctor and they need to be able to clean that out of your blood and still be able to control the bleeding. You've got to be in a hospital. So those are very dangerous if you're in a situation where you're going to receive an injury.
Yeah, also, to keep in mind, guys, I mean, anybody's on these probably know already, but Xarelto, Eliquis, and backwards is one more that I can't remember that there is no reversing agent for. Pradaxa there is now, I think, within the past couple of years they came up with something Pradaxa, but
Yeah, that's
there's
one of the newer ones.
yeah, but most a lot of hospitals. I mean, even when I'm in New York, there's some that have it, but there's even some hospitals out here that don't have aren't even equipped to deal with that type of situation. You know, bad like when I was on those medications, the number one thing they told you to watch out for, on top of me, you know, doing construction, cutting a finger off and bleeding to death, they always tell you got to watch so you don't smack your head. You know, that's one of the major things. I mean, I've cut myself on that stuff, and I've had to use Celox in the past, but just a regular cut, you will stop bleeding. It takes a really long time though, but you got to really watch the traumatic head injuries and stuff like that. That's, you know, and just be prepared. You know, that's why I say the medication list is important on that stuff, because something happens, you fall and your neighbor walks in, somebody's coming over to check out, just say hello, and they see you laying on the floor and you're taking a blood thinner. You need somebody that knows what you're on, that needs to get you to a hospital, not just try to wake you up.
Exactly. If you're an elderly person, I'm not, I don't know what you would call elderly. Probably, for me, it would be like, I guess elderly for me is like my age, 60 something. Then you would actually need to have that ICE card or whatever, the informational card should be pasted up by your phone or close by on a wall somewhere. So you keel over or something, hit your head, bump your head. The medics come in and they go, what does this person take? Maybe your neighbor found you. Your neighbor has no clue, you know, about what kind of medications you're on or anything, you know. So I would think that the first thing that the EMTs are going to do is they're going to look around your house, try to figure out. I'm not a doctor. Backwoods Law probably knows more. They're probably going to look around your house and try to figure out what kind of medications you're on.
Listen, guys, I hate to cut it so short, but I got to hop off for now. I got a couple things I got to take care of here. But thanks for having me on, Will. And it was good talking.
Hey, no problem. Thanks for coming by. I really appreciate it.
Good night. Shout out
more than welcome to come on anytime. You just let me know when you want to come on. We'll fix you up.
Yeah, I'll try to make them more often. But as everybody on here knows me pretty well in the chat and everything, that my life is one heck of a hectic mess at the moment.
Welcome to the real world.
But soon enough, I'll be out of here, and then I'll be having all you guys over for a barbecue.
There you go. Sounds like a plan, huh?
All right. Well, good night, everybody, and I will talk to everybody again soon. It's good hanging with everyone.
Thanks a lot, Matt. You have a good night.
You too.
Good night.
Yeah, he was touching base on large bandages. So you want to make sure that you're stocking up maybe on like 4x6 bandages for sure, and 2x3s, and all different sizes. You know, I mean, get lots of them, because like Matt was saying and like Backwoods Law was saying, you're gonna have to put a lot of gauze and stuff on there. You're gonna have to put direct pressure on there, and you may have to have somebody else put the direct pressure on there while you're doing something else. Is that right, Backwoods? Am I telling them right? Am I telling them about keeping a lot of gauze in their bag?
I mean, and the key thing to remember is gauze is very cheap. I mean, you can buy a box of the little 1-inch by 3 or 4 yard roll of gauze, a box of like 12 of them for about $2 or $3. I get them down at CVS, is the close one we have here. Just go and get 5 or 6 or 7 boxes of them, because they don't go bad. Keep them sealed in their little cellophane wrappers. They stay sterile. They're good to go. And like you said, 4x4s, 4x6s, 2x3s, all of those different sizes are good for different sizes of injuries. And you're not going to need one of them. You're going to need 20 or 30 of them at a time if you're trying to stop bleeding with direct pressure. Another good one to get is the Israeli compression bandages. Those are set up. I was just
getting ready to ask you to go through that, because that's an important one to have in your kit.
They have the 4-inch and the 6-inch ones. The 4-inch ones are for a little smaller type of wound, and the way the bandage is set up, it's actually kind of like an ace bandage that has a large amount of gauze in the center of it that's stitched into it. and then you wrap that around, and you don't want to obviously make it like a tourniquet, but you want to wrap it as tightly as you can, and the person still has feeling in their arm. What our rule of thumb is, when we apply it, we want to be able to fit one finger under the bandage when you're tightening it down, and that's going to be tight enough to get the direct pressure onto the wound. And the 4-inch ones, like I said, are for smaller, the 6 inches for a larger wound. And they also have what are called ABD pads. That would be for a much larger wound, or a wound, say, in the abdomen area, where it would be tough to put like a ace bandage, a smaller ace bandage around like your entire torso. The ABD pad, you can put that on there and maybe tie together 2 of the ace bandages and be able to get a compression bandage that way. Because you're talking about going around the entire circumference of the body. And of course, you're not going to tie that down as tight as you can either. You want to be able to get a finger underneath it when you have it tightened down. But that would be like a cut or a wound that's in the lower abdomen area, or a larger wound. An ABD pad would be perfect for. We lose Will. Oh, we lost Will.
I think so. Uh-oh.
Whoops.
We're back, aren't we?
Okay, there you go.
Okay.
Yeah. I was
finished
just watching
talking, I
everything
looked
kind
down
of
and
go
you were gone.
blink. Can you cover the SWAT tourniquet for us real quick?
Okay, there's a couple different types of SWAT tourniquets. The ones that are not advised are the thin ones. You want the SWAT wides. The thinner ones, the reason you don't want the thinner ones is the thinner that the tourniquet is in that style, the higher the compression is on the actual vein or artery, and it actually does more damage to the vein, to the point where you need a surgeon to be able to repair the vein after you apply that. If you use the wide SWAT T bandages, those actually are wide enough. You want it to be at least an inch wide minimum. The wider you get, the lower the compression is to be able to stop the bleeding in a limb. So if you had a 2-inch wide, that would take even less pressure to shut the bleeding off. A 3-inch wide one is like the gold standard. They're hard to carry though, but a 3-inch wide tourniquet will take even less pressure. It takes only about 50 to 60 pounds of pressure to completely shut off an artery or a vein. Whereas the thin SWAT Ts, which are very popular, a lot of people have them, you have to wrap that around 2 or 3 times. That creates somewhere in the range of 110 to 150 PSI of pressure on the vein. And it actually damages to the vein to the point where you have to have a surgery to repair it for you to keep that limb.
I was going to say that sounded like you'd have to be very careful with that. So if you
Very
would
careful.
So if we were to have one of these things in our trauma kit, would we need to get special training for that?
A SWAT T and a Cat 7 type tourniquet, those are pretty self-explanatory, and those are about 2 inches wide. So they use a very low amount of compression to do it. So I would suggest you either have the wide SWAT T or a Cat 7 Gen 7 tourniquet, Cat Gen 7 tourniquet, one of those two, because with the 2-inch wide, once you put it on, you cinch it down, and then you crank it down. You're just going to keep cranking on that windlass until the bleeding stops. Once it stops, you stop twisting. Boom, you're done. So you don't, I mean, that's pretty self-explanatory. It's just like in the Boy Scouts when I was, 10 years old. We were taught how to make a tourniquet out of a belt and a stick. Same idea, because typically your belts, the belts we were wearing, were about 1.5 inches to 2 inches wide, depending. But you get that around, like if somebody had an open wound on a leg that was profusely bleeding, we just go on there and you twist that down until the bleeding stopped. Once it stopped, you tie it off.
I watched a video that Dr. Bones and Nurse Amy did on the SWAT, and she actually demonstrated how to use it. The instructions are actually wrote on there, and it actually has like I believe it's an oval that when it's stretched to the correct amount, it's a circle. That it tells you exactly how to use it. So anybody can use it. She demonstrated two, and I can't remember what the other one was, but one of them was the SWAT. So
Yeah, the thin swats, the problem is when, number one, applying it to yourself if you're doing self-aid, it is a SOB to get it done on yourself and do it properly. Number two, a stressful situation, for you to sit there and read it, I mean, you want to practice doing this. You're obviously not going to shut off blood to somebody's limb, but you want to practice getting as tight as you can without causing severe pain to a person, applying it to someone else, because it's different. When you apply it to yourself in self-aid, you apply it much differently than you would if you were applying it on another person.
yeah.
So those are things you need to practice.
Yeah, and she demonstrated all of that, and it was interesting because of the fact that it's all wrote out almost like symbols. You know, it's very, very straightforward, very, very simple. Like you were saying, you learned it when you was a Boy Scout when you was 10. Now, my question is there that much of a difference between the tourniquets that you would actually have to have both kinds, or could you just choose which one you would prefer?
What we use in the medical profession, and that's because of protocols set by the doctors and the Department of Health in our state,
It's still going.
you can only use a wide SWAT T or a Cat 7 type of tourniquet. We cannot use the thin SWAT, because if we do that in a medical setting, we actually could be charged and thrown in jail for not providing the appropriate level of care to a patient. So that's why in the medical field, we can't use them. And that could be different in whatever state you're in, because all those medical protocols are all determined by your state Department of Health, and then the actual medical command that you work under as an ambulance or a rescue crew in that state.
Yeah, I actually took a CPR class and made the scouts take it with us. So we made sure the scouts got all their CPR and first aid cards at the same time. And you should see some of the things that 11-year-old kids put a tourniquet on.
Absolutely. And Wes Wynn brought up a very critical thing too that I probably missed in my spiel there, is actually learning where to put the actual tourniquet on, so that if an amputation is required, where you place that tourniquet could be the determining factor on whether it's an above joint or a below the joint amputation if it's required.
That's a very good point.
If it's after everything goes sideways, it really doesn't matter at that point, because you're not going to be going to a hospital anyway. You just need to stop the bleeding. But if you still have medical care available, where you place that tourniquet can make a large difference if that limb has to come off because it's just so mangled the doctors can't fix it. A below the joint amputation is preferable to an above the joint amputation. And it depends on where the wound is. You may not be able to do that, but you try and do that as much as possible if you can.
All right, I'm going to go through just if you guys are going to put a trauma kit together, most of you probably already have yours or are starting yours. Excuse me. But I'm just going to say what you should have in there or consider getting to put in yours. And we'll probably close it up because the thing's starting to blink on me. I don't know why, but I'll go over it with a pair of medical scissors, a fine pointed tweezer so you can get things out of the skin. Sometimes a jeweler's loop helps, or maybe even we were just talking about tourniquets. So, but other things would be like a stethoscope. They're not very much. I can get one at the pharmacy cheap, and blood pressure monitor, and also a blood sugar monitor, and those are not too bad. I am a diabetic, so I have all that stuff already, and it really doesn't cost very much. Thermometers are a dime a dozen anymore, so you can get one or two of those. They have those new ones. They come in a box. You just put them across your forehead now, and then maybe an eye cup, and that's a pretty good list just to toss into your trauma bag and just have in there in case that you should need them. So that's basically all I really have for tonight. I'd like to cover herbal and natural remedies next week if I can get Wayne to come up here.
Okay, Backwoods, you got another question. Old man is asking, what do you think of Caramax super absorbent dressings?
I just answered him. I just saw him. I haven't heard
Oh,
of that specific brand name. I think that's like a brand name, but I'm thinking that's probably going to be very similar to an ABD pad, which that's just kind of like a generic medical term, ABD pad. An ABD pad is super, super absorbent. So I'm thinking it's probably the Caramax is probably a brand name. But if we were using it on, say the ambulance or the rescue truck, we just call it an ABD pad. We don't ever look at who the manufacturers are. We just, hey, I need an ABD pad. We look for the large pad and we throw it to them,
Yep.
Makes sense. Okay.
Any other questions from the side chat while we're here? I know we've had some good questions.
I've been kind of keeping track. I haven't noticed any others.
Yeah, I'd see Westwind was answering, I think it was Corsairs was asking about a sucking chest wound. Yeah, if it's after everything goes sideways, sucking chest wound is way bad. No good. If it's not after a sideways situation, everything's gone to hell, that's where having those extra tools for someone who is medically trained that would come up on an incident where there's a sucking chest wound, having a chest dart in a blowout kit is critical, because that way, if you do have a sucking chest wound, I can, because I was trained to do it, actually release the air from your chest. There's another way to do it too, but typically that's only done in a hospital. It's called a chest tube. What you're doing with a chest dart is you're doing it through a very thin needle rather than a 14 French and jabbing it in between the second and third intercostal space. So that, yeah, sucking chest wound after everything's gone sideways is a death sentence.
This will make them comfortable, right?
Yep.
Anything else?
A couple of things that I thought about for a basic first aid kit would be anti-itch cream and creams for like poison ivy, like calamine lotion or something like that, and sunburn cream.
Those are all good things to throw in. Yep.
You can actually get sun poisoning from too much sun, so you got to make sure you treat that. With burn creams are another thing that you need to try to put in your kit.
And that's nice about the basic first aid kits. Like you get one from a Walmart, one of the larger kits, you're going to have that stuff in there. Also, if you're wanting a larger kit, like you're going to have a more fully stocked kit, it's the one I just got one, M17 Combat Medic Kit. There's going to be a lot of stuff in there. You aren't going to know what the hell it is, but there's a lot of stuff in there you can use that you would have the knowledge to use as well. And then, like I said, somebody who knows something about medicine comes along, they can help you out with the other items that are in there.
Yeah.
And make sure not sure if I said that, but make sure you get those little masks. Not the particle masks either, but a good medical one so that you can cover your face up while you're working on folks.
Actually, you want the particle mask, Will. The surgical masks, all that those do is protect the patient from your germs. It doesn't protect you from their germs.
Oh, really?
Yeah, that's just so that you know that the particle masks, the like N99 or the N100 masks, those are the ones you want to get if you're trying to protect yourself from inhaling something. A surgical mask, all that does is that keeps your germs from your nasal cavity in your mouth from getting to the person you're treating.
So all those ones I stole from the doctor's office are no good?
Well, they'll keep your son alive. You know, he won't get any of your cooties.
Yeah, I guess. I don't know about you guys, but they have boxes of them right there. They make you put them on if it's a sickness going around, you know. Here, we don't want to get sick. Put this on. So they put a whole box of them right there at the little thing where you stand in line to go up to get your number, you know.
Yeah, and that's because what that's doing is that's containing any particulate matter that could fly out of your mouth if you cough or if you sneeze. That keeps that all enclosed around your face, your mouth, so that you're not spreading it around to other people.
Yeah. Yep.
But it's not doing anything like if somebody doesn't have one on and they sneeze on you and the vapor actually gets into your eyes or something, it's not going to help you. Or the vapor gets onto your hand and you take the mask off and you wipe your nose. Yeah.
Yeah. Then you've got it. Yep. Yep. All right. That's about all I got, you guys. I want to thank all the guys that came on the panel. I really appreciate it. I want to thank Backwoods Law especially. He saved my bacon.
Yeah, he did.
I was glad I was able to get in with you this week. Well,
Yeah, I like having you on the panel, but
doing 2 in a row.
yeah, I like you being on the panel. You're a good guy, and I know you're a busy guy. So when you get to come on, I feel privileged.
I appreciate it. Thanks for inviting me in, Will.
All right. If anybody else don't have anything, we're gonna go ahead and close her up. And Wayne, I'll be sending you an email, buddy, so that we can talk about what we're gonna discuss next week. So without any further ado, you guys have a great rest of your evening and the rest of your week.
Night all.
Night.
Good night.
See if I find the right thing here. Hate only having one mouse.